Do you know how important it is to get in sleep? If you don't know, then it's fine because I am going to explain it to you. Hey guys, how are you all today? Hope well. Today I am going to discuss medical causes that can affect your sleep. In case you're not sleeping well, there may be a medical cause. Individuals who feel they rest completely well may at present be disturbed by unnecessary daytime drowsiness in view of an assortment of hidden clinical ailments. Snoozing unsettling influence might be an indication of a medical problem or an antagonistic impact of treatment to treat the issue. The pressure of interminable sickness can likewise cause a sleeping disorder and daytime sluggishness. There are many types of causes, but I am going to describe mainly 3 in this video. Before jump into the main video, one thing, if you like the video and find it helpful, then don't forget to like and share. Of course, if you want to stay with us, then just subscribe this channel and click the bell notification icon, so whenever any video will upload you get the note. Now let's go. Number 1. Chronic physical conditions. Number 2. Mental health disorders. Number 3. Neurological disorders. There are sub-points under each of these 3 issues. Chronic physical conditions. Under chronic physical conditions, there are heartburn. Resting in bed frequently intensifies indigestion, which is brought about by the reinforcement of stomach corrosive into the throat. You might have the option to maintain a strategic distance from this issue by going without overwhelming or greasy nourishments just as espresso and liquor at night. You can likewise utilize gravity for your potential benefit by lifting your chest area with an under-sleeping pad wedge or squares set under the bedposts. Over-the-counter and physician-recommended drugs. Heart failure. Heart failure is a condition portrayed by a slow decrease in the heart's capacity to siphon or flow blood satisfactorily. A cardiovascular breakdown can make liquid develop in the lungs and tissues. Patients with cardiovascular breakdown may stir during the late evening, feeling winded on the grounds that additional body liquid gathers around their lungs when they're resting. Utilizing pads to lift the chest area may help. These individuals can likewise be stirred similarly as they are nodding off by a trademark breathing example called Cheyne-Stokes breath, a progression of progressively full breaths, followed by a concise suspension of relaxing. Musculoskeletal disorders. Joint inflammation agony can make it difficult for individuals to nod off and to resettle when they move positions. Likewise, treatment with steroids much of the time causes a sleeping disorder. You may think that it's supportive to take ibuprofen or a non-steroidal calming drug not long before sleep time. Kidney disease. Individuals with kidney infection have kidneys that are harmed to the degree that they can no longer channel liquids, expel squanders, and keep electrolytes in the balance as proficiently as they did when solid. Kidney malady can make squander items develop in the blood and can bring about a sleeping disorder or side effects of eager legs condition. Despite the fact that analysts aren't sure why kidney dialysis or transplant doesn't generally return rest to typical. Thyroid disease. An overactive thyroid organ, hyperthyroidism, can mess rest up. The confusion overstimulates the sensory system, making it difficult to nod off, and it might cause night sweats, prompting evening time feelings of excitement. Feeling cold and sluggish is a sign of an underactive thyroid. Since thyroid capacity influences each organ and framework in the body, the side effects can be wide-running and some of the time hard to interpret. Checking thyroid capacity requires just a straightforward blood test, so on the off chance that you notice an assortment of unexplained side effects, approach your primary care physician for a thyroid test. Breathing problems. Circadian-related changes in the tone of the muscles encompassing the aviation roots can make the aviation roots contract during the night, raising the potential for nighttime asthma assaults that animate the sleeper unexpectedly. Breathing troubles or dread of having an assault may make it progressively hard to nod off, as can the utilization of steroids or other breathing prescriptions that likewise have an invigorating impact, like that of caffeine. Mental health disorders. Almost all people with anxiety or depression have trouble falling asleep and staying asleep. In turn, not being able to sleep may become a focus of some sufferers' ongoing fear and tension, causing further sleep loss. At this point of the video, I would like to say thank you for staying with us. General anxiety. Serious nervousness, otherwise called summed-up tension issue, is portrayed by tenacious pestering sentiments of stress, misgiving, or disquiet. These sentiments are either bizarrely serious or messed up with regard to the genuine difficulties and perils of the individual's regular daily existence. Phobias and panic attacks. Fears, which are exceptional feelings of trepidation identified with a particular item or circumstance, once in a while mess rest up, except if the fear is itself rest-related, for example, the dread of bad dreams or of the room. Fits of anxiety, then again, regularly strike around evening time. Truth be told, the planning of nighttime assaults persuaded specialists that these scenes are organically based. Depression. Since practically 90% of individuals with genuine sorrow experience sleep deprivation, a doctor assessing an individual with a sleeping disorder will think about discouragement as a potential reason. Getting up too soon in the first part of the day is a sign of gloom, and some discouraged individuals experience issues nodding off or get erratic rest all through the entire night. Bipolar disorder. Upset rest is a noticeable component of the bipolar issues, otherwise called hyperburdensome disease. Rest misfortune may compound or initiate hypermanifestations or briefly ease despondency. During a hyper scene, an individual may not rest at all for a few days. Such events are regularly trailed by a crash, during which the individual burns through the greater part of the following scarcely any days in bed. Schizophrenia. A few people with schizophrenia rest next to no in the early, most serious phase of a scene. Between scenes, their rest designs are probably going to improve, albeit numerous individuals with schizophrenia infrequently acquire an ordinary measure of profound rest. Last but not the least, neurological disorders. Certain brain and nerve disorders can contribute to sleeplessness. Dementia. Alzheimer's sickness and different types of dementia may disturb rest guidelines and other cerebrum capacities. Meandering, confusion, and tumult during the night and night, a wonder known as sundowning, can require consistent management and spot incredible weight on guardians. In such cases, little dosages of antipsychotic meds are more useful than benzodiazepine drugs. Epilepsy. Individuals with epilepsy, a condition wherein an individual is inclined to seizures, are twice as likely as others to experience the ill effects of sleep deprivation. Mind wave aggravations that cause seizures can likewise cause shortages in moderate wave rest or REM rest. Anti-seizure medications can cause comparable changes from the outset, yet will in general right these rest aggravations when utilized for quite a while. Headaches, strokes, and tumors. Individuals who are inclined to cerebral pains should attempt to stay away from lack of sleep, as the absence of rest can advance migraines. Both bunch cerebral pains and headaches might be identified with changes in the size of veins prompting the cortex of the mind. Torment happens when the dividers of the veins expand. Conclusion. Treatment with sleeping pills may be difficult because some drugs can worsen Parkinson's symptoms. Some patients who take drugs used to treat Parkinson's treatment may develop severe nightmares, others experience disruption of REM sleep. That's all for today from me. Thank you once again for still being with me. We'll be back soon.